All right, what's been going on now in the Medicare world? I'll tell you, it is absolutely pandemonium out there. My team is taking calls as fast as they possibly can, primarily answering one question: how do I get off of my Medicare Advantage plan? Why? I don't know. Probably because it's that time of the year where everybody can make the choice on Medicare Advantage or not. Medicare supplements, same thing. Doesn't matter what time of the year. You can join them, you can leave them, whatever, Medicare supplement. But Medicare Advantage plans, the zero premium HMO plans that everybody raves about with their pile of mail that arrives at their house, those plans, sometimes people want to get off of those plans. They determine that the prior authorizations, the getting everything pre-approved is somewhat burdensome, if not outright a flat no when you need to have things done in the hospital. The hospital co-payments themselves are quite burdensome in many cases. The limitation on network, like I said, prior authorizations or referrals to specialists is quite cumbersome to some folks. And then the exposure to cancer treatment, if you need it, or if they've heard somebody that's been on one of those plans and has experienced that, is quite burdensome to say the least. So let's answer in this video, how do you get off of a Medicare Advantage plan? Can you just make a choice and get back to a Medicare supplement or back to original Medicare? The answer is a little bit complicated because yes, you can get off of a Medicare Advantage plan during the annual enrollment period, annual election period, and whatever you do during this period takes effect in January of the next year. However, if you just go back to original Medicare, you're still exposed then to 20% of all the Part B costs, and then 100% of the Part A deductible on Medicare, and everything else that the Medicare supplement fills in those holes. So the goal is, if you're going to get off of a Medicare Advantage plan for any reason, and let me just clarify for some of the internet trolls that like to watch my video and create other videos saying otherwise, just because I don't have a primary focus in my business on pushing Medicare Advantage HMO plans to people does not make me any less of a professional than trying to do the absolute best to advocate for my clients. Because that's what I think my job is not to sell one product over another. It's to do the right thing for my clients. So yes, we certify and sell Medicare Advantage plans when they are appropriate. But I want my clients to have full disclosure on the good, bad, and the ugly, and when they've gotten into the ugly, how to get the heck off of them. So that's what we're going to do in this video today. So you're on a Medicare Advantage plan, and for whatever the reason, you've experienced the full depth and the breadth of the healthcare as is in some of these HMO plans, and you want to get back onto original Medicare. So the challenge is, again, if you go back to original Medicare without anything else in place, then you're going to fall through the cracks and be exposed to an unlimited amount of costs, mostly due to Part B costs. And that's everything outpatient. Today, most everything is done outpatient, including knee replacement surgery. Some big surgeries now are being done outpatient. All that's under Medicare Part B, as in boy. So that's the part where you have a small deductible with Medicare every year, calendar year, and then you have 20% of all the cost to bear on you unless you have a supplement or unless you've replaced Medicare with one of these private Medicare Advantage plans. So again, the topic is coming off of Medicare Advantage back to original Medicare. How do you do it? There are a couple of ways. First, I'll tell you the secret spy way that I heard from an agent years and years ago at one of the Medicare supplement conventions that we attend every year. And I'll be a speaker at the one next year. So if you're in the Medicare industry and you're watching this, come hear my presentation at the National Medicare Supplement Conference in 2020. It'll be in Chicago, Illinois. Anyway, the way that you get off of it in the secret way is you merely move out of the service area. You move out of the service area. Now, we live in America. You don't have to have papers to cross state lines. You don't have to get someone's permission, Social Security, Medicare, or anyone else's, to move out of a service area for a particular plan. Now, the thing about these HMO plans is they are very location specific. You can be in one zip code, but yet be in one county, step foot into another county, and the benefits for the Medicare Advantage plan can be altogether different. They are county and zip code specific for you. So if you are with it's a Aetna-Sig Medicare Advantage plan, and you move to another state to move in with a relative. Whether your move is a temporary one or a permanent one, it does not matter. If you notify Social Security, you're changing your address, and you notify Medicare, I'm changed my address, and you notify your carrier, I've changed my address, you're going to get a letter from them saying that your plan that you signed up for is no longer available to you with the benefits that were in your county zip code. So what does that mean? It gives you a get out of jail free card. It allows you then to return to original Medicare, and you have a suite of different options there. This is known as a special election period. It gives you some rights and opportunities to get off of that Medicare Advantage plan in a couple of ways. Now, you could either sign up for a new Medicare Advantage plan based on that new location where you're going to be, based on that address. You can then look at all the plans available there, and there may be a much better plan available to in the new location. Now, this again has nothing to do with the annual enrollment period. You can move anytime you want to. We are in a free country. So this little secret that I heard is, let's say, hypothetically speaking, you have someone who's on a Medicare Advantage plan and they move to the next state to live with their daughter. Maybe they want to live with their daughter for the summer. Maybe they want to live with their daughter until their daughter gets their stuff right. Maybe they want to move in with their daughter because things aren't going so well at the senior's home. It's none of Medicare's business how long you intend to stay, the permanent nature of your visit there, or what your intention is at the moment. It's none of Medicare's business. If you notify those places that you're going to move, Social Security, Medicare, your Medicare plan, and you're changing your address, even for a short basis, again, it's none of their business, that qualifies you for a special election period. Now, I mentioned one of the options you can do if you trigger that. You can get a new Medicare Advantage plan based on the location where you have landed there. Again, it will primarily probably have a network of doctors, a network of hospitals, and a series of benefits. You could sign up for that plan. But the other thing you could do, because what happens is now your Medicare Advantage plan will no longer be in effect when you move. And all these changes typically happen on the 1st of the next month. So if you move on the 20th of the month, they notify it, everybody knows. On the 1st of the next month, you no longer have coverage for that plan. So in your new location, either sign up for a new Medicare Advantage plan or go back to original Medicare, and you have a qualification now for a special election period into a Medigap plan, the Medigap plan that is designated for you as guarantee issue acceptable. So right now, as I make this video in 2019, I'm dating it now, Plan F is the guarantee issue go-to plan. There's a couple of others, but nobody ever buys those plans. Plan F would be the go-to plan for guarantee issue. Why is that? Here's my theory. This is only an opinion of Chris Westfall, the independent person. I'm telling you that this is my theory because the insurance lobby is very, very strong, very, very effective in Washington with CMS and the states as well. So if an insurance company could prod those that are being dumped upon them during a special election period. Now, the government says that you have certain rights, and these rights include you have to have certain plans available to you. If I were an insurance company, I would say, okay, if I have to take this person, you're making me give this person a plan, let's give them the plan that we make the most profit on. The highest premium, the greatest margin, and the greatest amount of profit for that person. That's my theory why Plan F is the guarantee issue go-to plan for people that are changing due to a special election period. This is also true and available if your Medicare Advantage plan just tells you that they're leaving the network. I used to live in the state of Florida, born and raised in Florida, Florida native, which is very rare. And in the state of Florida, Medicare Advantage plans are everywhere. There are a lot of small, very small, hospital-based Medicare Advantage plans that will pop up, have amazing benefits, sometimes even a Part B reimbursement of your premium, even giving you cash every month. It's crazy. But those plans often fizzle out. And when those plans dissolve because they were not profitable for whatever reason, we saw this all the time when I was there, these little hospital-based regional plans would just disappear. They'd notify you that, hey, at the end of this year, you have no more plan with us. Good luck. You have to go find another plan. If a plan terminates and drops you off, you have a special election period there too. And you can go get a Medicare supplement, the guarantee issue version of it. Now, I mentioned Plan F, the most expensive, the most profitable for the insurance company plan is guarantee issue. They also have this little tricky rule. These insurance companies, I'm just telling you the truth, okay? The insurance companies will tell us, the agent, that if we bring them guarantee issue business, they're not going to pay, they don't have to pay a commission. There are certain states that say, wait a minute, that would put the senior at a disadvantage. So you must pay full commission on the guarantee issue stuff, as same as you pay on the other stuff. Those states include, but not limited to, Utah, South Carolina, Colorado, and more. But for the majority of the states, the vast majority of the states, that's the word I was trying to say, agents are paid nothing for writing a guarantee issue application. Guarantee issue means there's no health underwriting. They must take you. This is different from open enrollment when you're brand new to Medicare. Guarantee issue is a special election period triggered by the fact that you moved outside the service area or your plan just up and left you. Another guarantee issue special election period is if you're in an employer plan, you're getting your health care from your employer, but you also started Part B of Medicare. You're maybe on a small group plan, and then that small group plan terminates your employment, terminates your benefits. That would give you an opportunity to get a Medicare supplement plan, Plan F in this case, guarantee issue. But will you find an agent that wants to write it? See, I'm also a businessman as well as an advocate for my senior clients, and it does not benefit your business. It's not a good business decision to write an application for insurance when you're not compensated for it, because we maintain things like offices, salaries, benefits for our employees and all that, phone lines and all that. Those things do cost money, and we are paid as an agent from the insurance company whenever we put a policy in force. Now, if the insurance company is saying, hey, I don't want that guarantee issue business, I'm not going to pay you any commission on it, then the agent's going to be more likely to say, well, it's not going to really cover me on my errors and omissions insurance that I cover to protect myself from making mistakes if I'm making $0 on writing that application. So a lot of agents will say, I don't want that guarantee issue business. And that's a bad place to put seniors. It really is. That's why I'm glad that South Carolina, Colorado, and Utah and others have put it into effect that you just do the best thing for your client, and the insurance company will, by law, pay you full commission, no matter if you're doing a guarantee issue case or a fully underwritten normal case. So, talking fast today. It's been an exciting day. So to get back to it, if you want to get off a Medicare Advantage plan, one of the tricks is you move outside the service area. You notify all the people you're moving outside the service area, probably another state. Then the company writes you a letter and says, you have a guarantee issue opportunity into a Medigap plan, which would be Plan F, for those people that are 65 prior to the year 2020. After year 2020, the guarantee issue plan for those people who aged into Medicare after January 1, 2020 is going to be Plan G, the Medicare supplement. So that's one option. They could get a Medicare supplement, Plan G, guarantee issue, with nothing that the company can say about it. They have to take those people. Companies don't want the business, obviously, and I understand why, because they can't screen them at all. But it is a loophole. It is a trick that somebody could use to get off of a Medicare Advantage plan anytime during the year. I'm just letting you know what's available. I'm not telling you to go do it. I'm not telling you to screw over your Medicare Advantage insurance company or a Medicare supplement company. I'm merely bringing you the facts that no other agent will tell you. This does exist. It is a true benefit for you having the freedom and flexibility of Americans to move from one location to another. If you do, it's a get out of jail free card. I do know of a personal situation in which a client that was on a Medicare Advantage plan, it wasn't my client, I didn't put them on that plan. They're on a plan that was going to now cost them an incredible amount on their plan for seeking cancer treatment. And they called me for advice, and I just hypothetically told them what would hypothetically happen if they executed this little known secret that I learned from my agent friend in California at the Medicare convention. They were able to utilize that, get off of the HMO, get full coverage for their cancer plan, because you have to look at the cancer coverage on a Medicare Advantage plan. You have to look at that coverage. Side note, if you have a Medicare Advantage plan and you're happy with it right now and you're not paying any premium, for goodness sakes, look into cancer insurance at least. Because you can't often pick your Part D drug plan. It's just incorporated. It's just sucked into the part of the Medicare Advantage plan. You can't go pick a good one. You have to take whatever comes with it. So at least if you have a Medicare Advantage plan, I highly recommend that you get cancer coverage, a full cancer policy that's going to pay you $10,000, $15,000, $25,000 cash immediately upon diagnosis. That is the way you can fill the majority of the holes, at least having to do with cancer coverage on a Medicare Advantage plan. But I digress. So this person, because of this scenario, was able to get off of the plan with very minimal coverage for the cancer treatment that was right in front of them, go on to a full comprehensive Medicare supplement plan and get the kind of quality care. Now, what happens is, what about the drugs? The special election period also allows you to get a drug plan that's going to be customized for you. A drug plan based on your new location. Now, what's the limitation on how many times I can move out of a service area to generate a special election period? There's not one. There's not one. The government can't tell you how many times you can move. So if you need a special election period and you move, you get one. That means you can change your Part D drug plan based on your new location. Hypothetically speaking, if you got a cheap drug plan and you come up with a diagnosis of something that needs a very comprehensive drug plan, and you moved outside the service area, I'm just following the logic here, what happens is you get a do-over. You can get a very comprehensive, yes, it's a higher premium, but it's probably a lot lower total out-of-pocket cost for your drugs because you have another chance at it, another bite at the apple, as they say. So that's one way to get off of a Medicare Advantage plan is by simply moving outside the service area, resetting your options. Now, the other part of that is you don't have to get the most expensive Medicare supplement plan, the plan that goes up faster in rates than any other plan. That's Plan F. That's the one that the insurance companies want you to have. If they have to take you as guarantee issue, that's what's set up there to try to protect their profits. At least they'll make the most profit from the plan that's going to pay them the most. Highest premium, highest incident of rate increases in the industry. But you don't have to do that. If you can health qualify for a different Medicare supplement plan, it is highly in your interest, your best interest to do so. They're going to ask you questions to see if you can qualify. Now, again, you moved outside the service area, creating a special election period. It does not give you opportunities to get any Medicare supplement plan, only the highest, most expensive one. So if you merely go through the questions for the health underwriting, and that's all it is questions. There's no blood work, there's no exam, there's no examination of your medical records. It's asking you questions that are then backed up by looking at a database, but they're asking you basically if you had a heart attack, stroke, cancer, hospitalization, some chronic disease that you're managing now, diabetes with complications or not. They're asking you those basic health questions to see if you would then qualify for the best Medicare supplement plan, a plan that will be stable, way more so than the guarantee issue option that they would give you if you only qualified for that. But it's always in your best interest to go for the thing that's hardest to get. Always in your best interest to go for the thing that's hardest to get. So if a Medicare supplement plan N, for instance, requires health underwriting, little tip for you, that's probably a much better place to be. And that's not one that the insurance company is going to go ahead and give you because you have a guarantee issue letter from an insurance company getting off of a Medicare Advantage and having an opportunity for guarantee issue. But just because you could qualify for a guarantee issue plan does not mean you should exercise that. The better thing to do is to talk to a trusted agent that does this every day and find out what those health questions are in the market that you're going, where you can buy a Medicare supplement and get the best plan if you can at all qualify based on the simplistic underwriting that's involved. It's very non-invasive. It's just asking you a few questions, asking what drugs you're taking to make sure that those drugs are not on a no-go list, and then we could tell you right away. Now, what happens if you get a Medicare supplement plan and you move out of the service area? Well, there is no such thing. There's no such thing as a Medicare supplement service area. So if I buy a Medicare supplement plan in Indiana, I can still use the same Medicare supplement plan if I move to North Carolina. Yep, same thing. It's like an indemnity policy. It's like a life insurance policy you buy on one coast of the country and you were to die in another state, it's still going to pay. It's still going to pay. It's real insurance. So your Medicare supplement, wherever you purchase it, it's still going to be good no matter where you go to. It's the Medicare Advantage plan that's geography based right where you were when you signed the application. That gives you an opportunity to get a Medicare supplement plan. So hypothetically speaking, let me finish this out by saying if you lived in the state of hypothetically Georgia and you're on a Medicare Advantage plan, suddenly you're going to need treatment that's going to really need to put that plan to the test, and you start looking at your summary of benefits in your booklet and you're like, oh my God, all these procedures are going to cost, wow, holy mackerel. And then you look at the limitation of specialists that can only be accessed through referrals from a doctor who may have an incentive then to keep you within his practice or her practice instead of shipping you off to the specialist. Well, just try to do it here in our office. You must wonder about the reimbursement rate there. Anyway, you decide for whatever reason, you'd be much better served on original Medicare with the freedom and flexibility to go to any provider in the country. It's including but not limited to the cancer treatment centers, the hospitals that specialize in whatever condition you have. They do not accept Medicare Advantage plans at those specialty hospitals, but they will assist you in most all cases to filing the Medicare claim if you had original Medicare, so you can recoup your money. Anyway, if you moved into a new area, you get a Medicare supplement plan, then you get to pick a new Part D drug plan, again, specific this time, specific to your list of drugs, saving you the most amount of money there and getting the best possible treatment on Medicare supplement. And then you can move anywhere you want to, keeping that valuable Medicare supplement. Again, they'll give you an opportunity for a guarantee issue plan, and you can take that if you want to pay the most money, but it's always best when you have a guarantee issue scenario to at least apply for, try to run through the health questions with a trusted advisor. See if you can qualify for one of those non-guarantee issue plans, one of the ones that are going to be more stable going forward. We have a lot of research on that, videos here on the website that explain which plans are better, or if you want a consultation and you think you might want to go through the health underwriting process to answer those questions, and you want to make a transition, give us a call. We'd be happy to help you here. The other ways you can get off a Medicare Advantage plan include this period of time, this annual enrollment period between October 15th and December 7th, merely by picking that as of January, I want to go back to original Medicare. You can do that. Same problem, though, arises. Only here, you don't have a guarantee issue opportunity to go back to a Medicare supplement, even the most expensive one. So what you have to do there is apply for a Medicare supplement, preferably one of the good ones, like we recommend, that's going to start on January 1st, and you can do it up to 90 days in advance during annual election period. So you submit your health answers to those questions, submit the application for a January 1 effective date. When you become approved, not before, when you're approved for a January 1 effective date on a good Medicare supplement plan, at that point, then you can go apply for a Part D drug plan, and you can notify your Medicare Advantage company, hey, as of January 1, I no longer want your restrictions. I no longer want your pre-authorizations, your pre-approvals, your referrals, your limitations on my care. I want real coverage with an absolute Part D plan that's customized for me, and a Medicare supplement plan that's going to fill all the holes. You can do that, but again, don't cancel one coverage until you're approved at the next level of coverage. That's what we work for. And you can pick a Part D drug plan anytime up until December 7th, and then there's a disenrollment period we'll be covering in a future video that starts in January. But that's a whole other topic. We'll get on that. But as far as leaving a Medicare Advantage plan, two primary ways. One is during the annual enrollment, annual election, open enrollment period, which is not open enrollment for anything. The open enrollment is truly when you're turning 65 or you're brand new to Medicare and the world is your oyster. You can pick any Medicare supplement plan, no underwriting. You can pick any Medicare Advantage plan, no problem. You only get one of those. Typically, you only get one, unless you stopped Part B, went out of the country or something, came back, started Part B again. It's a rare case, but we see it. But this period of time is the annual enrollment period to figure out what you're going to have for January for Part D drug plan or Medicare Advantage plan. So if you want more options, you think you might want to go through the health underwriting process to answer some health questions and put you on maybe what might be for you a better plan for January, you can call my office. We'd be happy to help you. We're in 46 states. Probably your state is covered by what we do. If we're busy on the phone, please don't get frustrated. Apparently, there's like 62 million people in America that are on Medicare, and they're told by everybody, including all the mail and all the TV and radio and everything else, that they have to make a decision right now. So all these people apparently are calling everyone's office right now. We're helping people just as expediently as we can. We have a friendly team of people waiting to take your call so we can see what those options are for you. But if you want to go from one Medicare Advantage plan to another, that's what you can do during this period as well. If you want to go from a Medicare Advantage plan back to original Medicare, my suggestion is first apply for a Medicare supplement to start to take its place and get through that approval process first before pulling the ejection seat. We covered a couple of options here. I hope one of those is something that will help you, or maybe someone that you love, that you know, maybe going through some frustration with how are they going to figure out how to get off of this plan that maybe not serving them to the level that they deserve. And that's what we want to do with our clients. I'm Chris Westfall. Thanks for watching. If someone you know could benefit from this, please share this video to them and subscribe to the channel, because there are some interesting updates coming up with Medicare that may affect you if you're on Medicare. And the best thing to do is subscribe with the subscribe button there so you can stay tuned. All I do is Medicare, and I want to help people. So if that's you, let me help you. Have a great day, y'all. Bye-bye. And it says here in the study, now this is prior authorizations for treatment that you or your doctor say you need to have. While Medicare Advantage plans are required to cover the same health services as original Medicare, Medicare Advantage plans are not required to offer the same level of provider access and can impose coverage restrictions like prior authorization that require enrollees to take additional steps before accessing prescribed care. If a service is covered with prior authorization, enrollees must get approval prior to the plan paying for the service. If approval is not granted, the plan generally will not cover it. So from the Kaiser Family Foundation study, 80% of Medicare enrollees, Medicare Advantage enrollees, are in plans that require prior authorization for at least one Medicare covered service. Now, it's important to keep in mind that original Medicare does not have prior authorization as part of it.